First of all, I'd just like to reiterate the figures to last night at 8 p.m. To 8 p.m. last night, I'll make some qualifications of this in a moment, but to 8 p.m. last night in New South Wales we had 14 new cases. So that's taken us to 3,278 cases in New South Wales. The cases came from 18,524 new tests, and that is, again, thank you to the community for ensuring that you come forward for the testing. There have been, though, another couple of cases today, and that's the purpose primarily of this particular press conference. During the course of today, we have been notified of two cases that there's a lot of follow-up going on, but one particularly we need to make sure the community is aware of. So I'll just address one of those cases first. I remind everybody that in the last few days we announced that there was a 30-year-old woman from the Liverpool area who tested positive. In the course of today, we have found a gentleman in his 50s who has tested positive in the same vicinity. Now, as you're all well aware now, tracing instantly starts occurring in New South Wales. It's been one of our strengths. Once we have a positive, the positive case, the tracing staff here in the Ministry of Health commence a very detailed process of tracing all contacts. In the course of that, it occurred to the tracing staff that this woman who had become positive in the last few days should have her facts looked at and revisited. And what's been found is that that particular lady and this 50-year-old gentleman both attended last Saturday night independently at a hotel. That hotel is the Crossroads Hotel at Casula. Now, obviously, that has major ramifications because that appears to be, we're still checking it, but appears to be a likely point of connection where the two people could have actually come into some contact, at least with the virus, not necessarily directly, but certainly with the virus at the same location. So, as we speak, New South Wales Health has been in contact this afternoon with the management of that particular hotel, the Crossroads Hotel at Casula, and has asked them, in fact directed them, to close and to provide all necessary details. Now, you'd recall that the government has made very, very clear rules for pubs and clubs and cafes to keep the list of names of people who visit. So if the hotel has complied in the way that we would hope, then we'll have access to those names from the Saturday night usual events at the pub, and the tracing is underway as we speak. Right here in this building, that tracing is now happening. As of 5 p.m. this afternoon, there will be a pop-up testing facility, COVID-19 testing facility in the car park of the hotel. So I'm asking people who might have been in that hotel and have any symptoms at all, anything at all, from Saturday night, but I'd go further and say if you've got any symptoms at all and you've been in that pub in the last few days, just in case there has been some contamination of tabletops or whatever it might be, to get yourself along and get tested. There will be additional facilities. The Crossroads, by definition, has people coming from different directions, so there'll also be testing facilities at the Fairfield Hospital, the Liverpool Hospital and the Campbelltown Hospital. So I would just encourage all of our local residents and people who may have visited that pub in the last little while to get along. If you have any symptoms at all, please get along. Why New South Wales has done so well to date is because our community have been very prepared to get along and get tested. The second case is troubling, I must say, from my point of view. This is a man in his 20s who has tested positive in the Sutherland area he is from Victoria, from Melbourne, and he's come up in the last few days. He has tested positive. We're doing investigations at the moment, contacts, etc., and that will continue. At this point, because it's so early, I won't be saying much more, but he did, I can tell you, tow his caravan up from Victoria in quite a long drive from Victoria. I understand 14 hours straight through, so I'm told. And he is now here. I thank him for coming forward. That's excellent that he came forward, and I encourage others in his similar situation who may have come out of Victoria or Melbourne particularly in the last few days to make sure that you're on high alert. Because we in New South Wales are on high alert, and we want you to get tested if you have symptoms. It's crucial you do, because otherwise you will be the instrument of seeding, or one of the possible instruments of seeding here in New South Wales. So this gentleman has done the right thing and come forward, and I thank him for that. And I don't intend to name the caravan park at this point. There'll be more work done by Health this afternoon, but you can imagine that we are looking to what other measures, Health is looking to what other measures might be necessary for others in and around that car park, in and around that caravan park. But obviously, first of all, there needs to be full questioning to make sure that we know what his contacts might have been. So, can I just say on that front, New South Wales runs the risk at the moment of people coming out of particularly the Melbourne area, if they have ducked out of Melbourne, perhaps just before our new laws came in, our new orders, or perhaps if they've come out since the orders, you would know that you are potentially a risk to the community of New South Wales. I would ask you at this point to consider packing up your caravan, packing up your tent or whatever else you've got, and head home to Victoria. Your government has put in place some very strict guidelines and rules. It's not helpful for you to be out of that environment if you've been in that environment. So I would just stress that to you. As Health Minister, please go home as soon as is reasonably practicable. Go home. If you can, go home. Go back to Victoria and go back to your area and comply with your own government's laws. Just want to also address one issue. As I said earlier, fantastic. I want to thank the New South Wales Pathology and all of the private pathology firms that we've been working with. If anybody had asked me back in January whether we would have had more than 1 million tests for COVID-19, I wouldn't have believed it possible, but we've already passed that 1 million mark here in New South Wales. So as at last night, we had 1,007,662 tests. So thank New South Wales Pathology, but also thank you to the community. Our community, as I said earlier, is fantastic. Thank you so much for doing that testing, because if you don't step forward when you've got any symptom of a cough or cold, anything at all, dry cough, itchy throat, whatever it may be, a bit of a temperature, then you're putting yourself at risk, but you're also putting your family and the community at risk. Off the back of that, I just note that today, there has been some media talk about some pathology tests that were taken off the back of the case that occurred in Woolworths, I think about a week or so ago. The gentleman there who was working in Woolworths and again came forward and was tested and did exactly what he should do. And we've had a lot of the community come forward and be tested in that Balmain Rozelle area out of the many, out of more than 1 million cases of pathology swabs. 77 of those swabs have had apparently been misplaced in the system. They're still trying to work through that, but as Health Minister, I've indicated to New South Wales Pathology that I'm grateful, very grateful for all the work they've done, but asked them to look at what system issues there might have been, and hopefully in the next few days I'll get a report about that. But in the meantime, the most important thing is to say to those 77 people, on behalf of New South Wales Pathology, they regret very much that those 77 have been misplaced in the rush to get so many tests done so quickly. But they are also asking for you to come back and get retested. And obviously, I would ask that as well. Please come back. On behalf of New South Wales Pathology, I'm sorry about that, but I think everybody understands. I've referred many times to this being like a war. There's a lot happening every day and a lot of people under massive pressure. I'm not going to point the finger at anybody. I'm just asking that New South Wales Pathology give me a report at some stage and explain why and what they're doing to try and address the issue. Although, as I said, it's war-like circumstances and these things can happen from time to time. I'm going to ask Dr. Chant whether she'd like to add a little more, and then I'm happy to take any questions on any other issues. Dr. Chant.
Thank you, Minister. Look, I would just like to reiterate the message that anyone who has been in Victoria, and in particular metropolitan Melbourne and the Greater Metropolitan Melbourne and the Mitchell Shire, that's where the majority of community transmission cases have arisen from. Please ensure that you come forward for testing with even the most minimal of symptoms. Also, we're asking that regardless of whether you're covered by any of the public health orders and those self-isolation requirements, we are asking you, if you've come back from those hotspot areas in particular, that you minimise your contact with anyone. Don't go into large gatherings. Keep away from others for 14 days since you have returned from those areas. Thank you.
Any questions?
With the hotel, any idea how many people were in the pub on that Saturday evening?
Sadly, at this point, no. But I suspect the particular hotel is quite a popular hotel, and I understand it would have been pretty full. So,
shouldn't they have been taking people's numbers and numbers?
Yeah, they should have. And we're hopefully, I mean, every pub, that's what I said earlier, Chris, every pub, every club, every restaurant, every cafe should be complying with COVID-safe plans. And of course, a part of that is to ensure that we have the names and numbers of guests, and that's what the health staff, the tracing staff, are currently working with the pub on.
So they did that. They had that in place.
We don't know that yet because
I think, Minister, we're advised that we're advised that they did have a COVID-safe plan. We're just checking the documentation around the contacts, but I do believe, in preliminary sense, I've been advised. I always like to double-check this, and you can imagine that our focus today, since was rapidly engaging with the hotel. We're very pleased that they've closing. We've got a pop-up clinic there at 5 p.m, so things have been moving quite quickly. But at this stage, I really appreciate the cooperation we've been getting from the pub.
Do you know that the two people were there? It is a big pub. We know, we've established whether they're in the same area at the pub.
We are. So these individual cases, one arose from a case in Springwood, and another person, the person was in relation to Liverpool. We now go back the 14 days and look at common points of exposure, and that piece of detective work concluded that found that they were both in that same spot at that same time. So what we're obviously looking for is who was the source that potentially infected those two individuals at that time, and that's why it's essential that anyone who was in that hotel at that time in the overlap, that we undertake testing. Regardless of whether you've got symptoms or not, we really want to track down and find out the source of this infection to block any further trains of transmission.
With the Victorian man, do we know in what suburb he was staying at a caravan park? He just said the Sutherland Shire. He
was staying in the Sutherland Shire. We're just re-interviewing him. He's isolated. His close contacts are largely household members and very small limited number of contacts. We're currently interviewing them. This has just been notified today. We're just in the process of doing that public health follow-up.
Where was he from? Where was he from in Melbourne, and at what border point did he come through?
Look, I'll have to confirm those details to ensure that they're accurate, but I am aware, I understand that he did come from Melbourne, a Greater Melbourne metropolitan Melbourne area, but I will confirm that, and I will confirm his movement dates.
So do you know what town he came through, what border town he drove through?
We are currently interviewing him, re-interviewing him to ascertain all of those information. At this time, because he was travelling in a car and in a caravan and did the trip quite swiftly, we understand that he has not had any minimal, if any, exposure to anyone on his route up here. And as I said, it's just the person he's within the caravan and one or two other contacts that we're now exploring.
What day did he cross into New South Wales?
As I said, I will get you that information just to ensure. We have got some preliminary information, but I want that to be double checked for accuracy. This is our focus this afternoon, has been rapidly getting the information on these cases so we can alert the public and take that public health action to prevent transmission.
This is the first. We've had schools, we've had nursing homes, we've had hospitals. Is this the first time we've seen a cluster possibly form from a hotel?
We have seen some cases occur in workplaces, hotels. I think this reflects the detective work and the fact that we're looking for all our cases to really determine that point source, because we're so keen to break down any chains of transmission. Obviously, any setting, COVID can be spread, and that's why we're particularly mindful of reinforcing the need for that social distancing, the hand hygiene. And can I just say, if you are going into those restaurants and cafes or pubs and clubs in the days ahead and you're asked to put your contact details, this case again highlights why giving accurate, legible contact details will make the public health response much easier.
So you're pretty confident if they've done, they're COVID friendly, you're pretty confident you'll be able to track everyone down who was at the pub on Saturday?
If everyone has, there's only so much a facility can do, so that if they have, I'm advised that they do maintain lists. Now, if those list people wrote legible, correct information on their list, it will be incredibly helpful for us. And obviously we are releasing this publicly as well. So we're using both mechanisms, but certainly having that direct ability to contact people will be incredibly beneficial in the public health response.
Do these cases concern you enough to look at tightening restrictions, again, in New South Wales?
Look, I think it's premature to look at that at this point. Our focus at the moment is really understanding the scope and extent of exposure at this time. We want anyone who's been in that hotel at the time to come forward for testing. We need to assess the situation, but that is the principal public health action. We just need to have everyone re-present for testing, and so we can further assess the situation.
If it's premature now, what's the threshold for looking at tightening restrictions? Is there a number in terms of community transmission?
The situation is evolving all the time, and we can continue to think about the settings or the public health measures we need in place. What we particularly need the community to do at this point in time is to adhere to the existing restrictions. We have seen some behaviours creep in, and I'm sorry, the environment, I just noticed a few more people are less than the 1.5, and it's probably partly the environment. But if you're out and about, you do see people just getting that bit closer, interacting in groups, and it is important that this is not the time for complacency. We do have increasing transmission in Victoria, and it highlights how quickly COVID can spread. And it's important that we both get people to present immediately they've got symptoms. That will help us the most, and maintain that social distancing and hygiene messages.
Is the Victorian team that was isolating in Merimbula, is that a confirmed COVID case?
So the case in Merimbula is absolutely a case. So this was a child who had been diagnosed in Melbourne, had done the right thing, absolutely. Was tested prior to coming into New South Wales because they were going to spend some time with family. They were advised the test result was negative, and then subsequently, days later, after they'd already travelled, advised that it was positive. So that is definitely a case. And we indicated the positive actions of the hotel that they had visited, and also confirmed that apart from the household contacts in those sort of family groups, they had not had significant exposures further than that.
The Melbourne man in his 20s, was he tested in Victoria, or was he tested?
He was tested in New South Wales.
Just for Mr. Hazzard. Would you consider tightening the laws to stop caravans coming in unless it's New South Wales residents in light of what's happened?
Look, I think, as Dr. Chant has said, and as I've said many times, this has been a journey, an evolution in the last 5 months, nearly 6 months actually. And Everything is on the table, absolutely everything. We take health advice as the government, but we also have to make decisions in the interest of our community. There are a lot of things under active consideration at the present time, but it's not appropriate that we make any further announcements today, particularly conscious of the challenges the Victorians have at the moment with the escalating numbers in and around Melbourne particularly, and certainly want to see the citizens of Melbourne and Victoria comply with their state laws and our laws. Effectively, they just shouldn't be coming here.
Is this caravan case evidence that you might have acted a day or two too late on the border closure?
Everybody across the world takes advice and works to their best of their ability. I think that the decisions that we took are entirely appropriate, but we have to look more closely at the circumstances of how this gentleman and when this gentleman came up in due course. But right now our focus, as Dr. Chant has said, is the public health aspects. Obviously there are very strong penalties, and I remind the community that if you breach the orders, there's 6 months jail and $11,000 potentially that you could end up paying if you come to New South Wales and breach the orders.
How much is
Now, sorry, Chris. Now, whether or not there are breaches in this particular case, I'm not prepared to make any comment on this at this point, because the focus right now is the public health response. And the public health response has to be about making sure people are not afraid to come forward and actually tell us they're feeling a little ill. So, and that's obviously what this gentleman has done. He's not felt well. The question was just asked, was it tested here or was it tested in Victoria? No, he came up here and then felt ill. I think it might have even been the next day. He hasn't been here all that long in the last few days. So I think this is the sort of approach we should take at the moment.
Before the outbreak in Victoria, the Premier had flagged that come August, if everything went well in July, we'd be looking at loosening some more restrictions on night bars and nightclubs and weddings as well. Is that currently under review because of what's happening in Victoria?
At the moment, the government's focus is very much south, and we're looking at what's happening there. And I think the community, many community members have expressed strong views as to whether or not we should be getting stronger measures. So at this point, as Health Minister, I'm certainly not actively considering those issues. I'm more considering how we make sure we keep New South Wales safe at a time when we clearly have some major challenges just south of our border.
We've had a pretty good run in recent weeks, particularly in community transmission. How much of a setback is this in the fight?
Which aspect, I'm sorry?
In terms of, you've had a good run.
Yeah, but what
over
aspect
your
are you
shoulder to
saying?
see what's going on in Victoria. In terms of where we're at, we've now got people running around clearly that have got it, who may have got it from either the Victorian or in the hotel. I'm saying just like psychologically for you and your team, just how much of a setback is it?
Psychologically, as Minister for Health and the team in health, we're all on high alert, extremely high alert. And we will be actively considering and recommending any further steps that we need to keep New South Wales safe, having in mind that there is apparently a growing army of people with this particular virus in Victoria. It's very concerning.
When you say everything's on the table, can you just give us some idea?
No, I'm not going to go into any more of that. I've been here for 6 months doing this. Not about to start postulating and hypothesising. Every day is different. It's great for you, but not great for me. So any other questions you'd like to ask?
Sorry,
Yes.
Dr. Balmain, so we've got numbers that there were 200 tests that were lost. Can you just tell me what happened?
I think I just told you before.
No, so just elaborate on
It's not 200, it's 77. Well, there are 77 out of the many thousands, out of more than 1 million cases of pathology that have been taken in New South Wales, swabs that have been taken. Obviously, from time to time, human error will occur. That's normal. It's a human system. And somewhere, obviously, a human or humans in New South Wales pathology made a mistake, and that's all I'm going to say, except to say that I'm not condemning them. I'm asking them to continue to work the enormous hours they've been working and to thank them for the work they've done, but also to say that they've now actively contacting the 77 people whose swabs were taken, and thus far there doesn't appear to be any major issues out of it, except that there have been inconvenience, and I apologise on behalf of New South Wales Pathology for those cases.
Just for Dr. Chan.
Sorry,
Just have
Dr.
questions
Chan?
for Dr. Chan.
Okay.
So with the woman with the Kasua Hotel, so did she have symptoms when she arrived? Do we know that, or was she aware that she was sick?
No, so just to explain this, that This is about finding a source. So what we've found is that these cases developed symptoms after they had been at the hotel. And what we're looking at is where people may have acquired it, because for cases, we're trying to find the source. And so what we go back is go back the 14 days, which is the incubation period, and look at where people have been. And the fact that both these cases had been at the same hotel in an overlapping period of time on the same day gave us cause for raising the possibility, and the strong possibility, that they both acquired the infection at the same time from a third party at the hotel. So this is actually, whilst a concerning story, is also a positive story, which is highlighting the fact that if we can get these cases detected early, and I want to thank the clinical staff involved in the care of the lady from Liverpool who tested her, and also the gentleman that came forward for the testing promptly, that's actually allowed us to identify this common potential source and track down whether anyone else on that day was positive. And that will help us stop any other threads of transmission. And that is why getting tested, even if you're a young person and you've got the mildest of symptoms, because your actions help us stop the spread within the community.
And just with the 39-year-old woman who also tried to escape hotel quarantine in Sydney, have we tried to review how she got out or who's at fault there?
Look, I'll have to get an update on that case. I've not been briefed about that.
Sorry, could I just say one final thing, and that is this. Obviously, there are issues around this pub. There was issues around another pub only yesterday. The one thing I would say to particularly younger people is complacency is a killer. It may not be you, but it may be, for example, your granny or your pop. For heaven's sake, get serious. Social distancing and just being cautious around other people is critical.